presentation. Hey guys, it's Morgan, and I chose to do RSV for my presentation. At the bottom there it says help save tiny lungs and know the symptoms because I decided to focus my presentation more on the RSV that affects premature babies because it's pretty serious. But let's go ahead and get started. So we'll click on what is RSV. It's called respiratory syncytial virus. It is a common infection in the lungs and the respiratory tract. It sort of acts like a cold and can also cause life-threatening pneumonia in older adults and can be misdiagnosed as influenza. So my symptoms and the rest of the presentation are going to be geared more towards those premature babies and newborns. But children are most likely to become affected before age 2, just aren't hospitalized. Only 1% is hospitalized because of the labored breathing that it causes. I added a video down here just to see what the labored breathing looks like. It's like diaphragmatic breathing where they use their chest muscles and a lot of belly breathing, and this little baby is also grunting in the video, but what it doesn't show is that flared nostrils can happen because they're not sure how to compensate for their breathing. Wheezing can be heard in the lungs, and pausing can happen during breathing because they're just having a tough time getting that air in. Another thing to look out for is central and peripheral cyanosis, and that's when their lips and their fingertips start turning blue. And also be aware of dehydration when you're not changing their diapers as often. When they cry, you're not going to see tears form, and they're not going to be drinking as much milk or formula. Those are signs of dehydration. So we'll click on that little video just in case it doesn't play in your presentation. A lot of belly breathing and grunting. It's pretty short, so watch it again if you need to. But these symptoms here are for adults, and they're not as serious, and most people aren't going to be hospitalized for them unless they are not able to breathe very well. So those are going to be runny nose, decreased appetite, coughing, sneezing, fever, and wheezing. So pretty much imitates symptoms and signs of a cold. So we'll get out of here really quickly. The next one we're going to go through is pathogen and the virulency. So it is a respiratory droplet transmission, and it's from the Paramyxoviridae family, which is a human reservoir, and so the capsid formation will be spontaneous, and there's a process called the budding process, and it allows for protein envelope to develop around the capsid. It's also an RNA virus that encodes for about 10 proteins. And so the G protein, it virally attaches to the cell, while the F protein, it promotes syncytial formation. And that syncytial formation is what causes cell fusion when it's grown in a cell culture. Basically, several adjacent cells fuse, forming large multinucleated cells. And that's what that syncytial formation is, which is where the respiratory virus got its name from. So we will click on to the next one. So it's a virus that is seasonal in the winter and the spring. It's more prevalent. It also is a long-term immunity. The long-term immunity is low. So basically, you're going to see more recurrent infections. But it's not going to be as serious in children over 2 and adults. So the dangerous RSV typically occurs in preterm babies, infants under the age of 6 months, and children with weakened immune systems, and those older adults with even weakened immune systems. One thing that I definitely forgot to mention is that fever can occur with this virus. A lot of the times it occurs when there's bacteria involved in this virus. But anyways, it's more likely to happen in pre-existing conditions like cardiac, pulmonary, neurologic, and immunosuppressive disorders in elderly. And they are even high risk for death and mortality rates. It's also going to occur less often in tropical and equatorial climates, which is why it makes sense that it's a winter to spring virus. And one thing I wanted to mention is that it is responsible for 14,000 deaths per year. And those are going to be those higher risk people, the elderly and preterm babies. So we'll get into the diagnosis and the treatment, but before we do that, I just want to mention that for the treatment for people that don't need to be hospitalized, you can just use a cool mist humidifier, bulb suction for mucus, increase fluid intake, and try to sleep in an upright position, because when you're laying down flat, your lungs will be, it'll be harder for you to breathe because they're going to be filling up with fluid. Administer nasal saline drops, and even using Tylenol to reduce the fever. But for the diagnosis and the treatment for the more serious cases, you're going to be evaluating the lungs, listening for those wheezing sounds, looking for O2 desaturation and looking for those virus antibodies using like the nasal secretions in the serological testing. And so you'll treat them with oxygen and suction the mucus. And most of the time, these premature babies need to be intubated for a ventilizer and nebulizing albuterol. One big thing about prevention is that it's a hand hygiene. It's another one of those things, just like COVID-19, we need to be practicing hand hygiene more often. And I put that little baby on there with the kissing marks on it because you don't want to be kissing babies with this virus. And generally, it's just not good to kiss babies because of so many other virus transmission. So you want to educate your family and friends that might be in contact with the baby, and they should know. You shouldn't be going out and kissing other people's babies, and obviously if they're in the hospital, they're going to be restricting visitation to only immediate family members anyways, and you want to keep the environment surfaces clean, so you're going to be cleaning when that baby is allowed to go home. Also, another good prevention to talk about is the palivizumab antibody. It's a prophylactic, and prematures and children up to 2 years old can have that prophylactic monthly vaccine. Also, there is clinical trials going on right now for the vaccine to be given to pregnant women so that passive immunity might be able to affect prevention. And I think that was everything. All right. Thank you.